If you experience sensitivity to hot, cold, or sour foods, feel pain or discomfort while brushing your teeth, or notice in the mirror that the root of your tooth is exposed, this means that the tooth may suffer irreversible consequences. You need to pay urgent attention to it. Give a like if you've ever experienced sensitivity. Many people ignore exposed roots, thinking it will go away on its own, or that it's not a big deal yet, or they simply don't notice it at all. While people think this way, the gum recedes further, the roots become more exposed, the teeth get looser, and treatment becomes more difficult. It can get to the point where a completely healthy tooth falls out. By watching this video to the end, you'll be able to determine for yourself whether you have teeth at risk, and you'll learn how to stop this process at home without surgery. The first reason why tooth roots can become exposed is improper brushing, more specifically using the wrong brushing motions. In other words, we should only use sweeping motions. So if it's the lower jaw, the motion should be from bottom to top. If it's the upper jaw, then from top to bottom. But with horizontal movements, when we move the toothbrush back and forth, we actually injure this very delicate papilla, which hugs our tooth in the form of a crescent-shaped border right at the base of the tooth. These movements cause significant trauma to this delicate area, and the gum begins to recede. Another incorrect brushing motion is moving up and down while brushing both the upper and lower jaws at the same time. The bristles get under the gum, also injuring it, and the gum starts to recede as well. So improper brushing movements are the primary cause of gum recession around our teeth. Also, the first cause includes choosing the wrong toothbrush and toothpaste. When we choose a toothbrush that is too harsh, it also injures the gum papilla, causing the gum to recede. Or if we use an abrasive toothpaste, we damage not only the enamel, but also the gum. By the way, we have a video on our channel about how to properly choose a toothbrush and toothpaste. The second cause of exposed tooth roots that I want to mention is dental calculus. It is dental calculus that forms precisely in the cervical area, right where the gum meets the tooth. It is dental calculus, specifically, that starts to push our gums away. In other words, once it forms and we don't clean it off, it only gets bigger and, so to speak, builds up. As dental calculus builds up, it gradually pushes the gum further and further away. And when we remove this dental calculus, our gum has already receded, so to speak, it has stretched. And the most insidious thing about dental calculus is that it not only pushes the gum away, but it can also go directly under the gum. That is even more insidious. In other words, you won't see that you have it, but it goes deeper and deeper, thereby separating, actually not just as if, but truly separating our tooth from the ligament that is from the bone. And a space appears so that an absolutely healthy tooth starts to become loose. That's why dental calculus is the most important cause of our roots becoming exposed. The third reason why tooth roots become exposed is bruxism and excessive load. What is bruxism? Bruxism is a condition in which a patient grinds or clenches their teeth at night. This happens when, let's say, the nervous system doesn't rest, and a person compensates for this at night by moving their jaws. They clench very hard, grinding their teeth against each other, even though they may not notice it at all. Only their loved ones who are nearby and hear it will tell them about it. That's why this insidious condition, bruxism, leads to constant pressure on the teeth, not just on the teeth themselves, but also on the tissue or area surrounding the tooth. This is called the periodontium, and this area is not designed for such constant stress. In other words, our teeth are meant to chew and then relax, chew, eat, and then rest. But here, there is constant pressure throughout the night on the teeth and the periodontium. And again, as I said, it simply isn't meant for this, and the gums start to recede because this area just gets tired, so to speak, from this constant work, from the ongoing compression. The same thing happens with overload. Overload is when the remaining teeth take on the function of the missing teeth. Most often, of course, we're talking about the molars. So if there are no molars, we start chewing or using the teeth that aren't meant for this purpose. Yes, they manage, yes, they chew, but in the same way, from constant use, let's say the same incisors, the front teeth, which are meant for biting, breaking, or tearing food, they are not meant for chewing, but they end up chewing. And so it's the same situation. The periodontal tissue is not designed for this and gradually wears out, and the gum recedes in the same way. So what exactly are the dangers of all these three causes of root exposure? The first, of course, is cavities. That is in the area where the tooth has become exposed, where the neck of the tooth appears and there is no enamel. This area will be much more susceptible to cavities. So cavities will develop there faster, almost instantly. And most importantly, it will immediately penetrate directly into the tooth, that is, into its root. And then you'll have to treat not only regular cavities, but also the roots of the teeth. Cavities develop there simply because there is no enamel, since only tooth enamel protects the tooth from cavities. And where the root is exposed, there is no enamel, so the process will penetrate into the tooth as quickly as possible. The second thing that can happen to an exposed tooth is, of course, further exposure, and as a result, the loss of an otherwise completely healthy tooth. The tooth, a healthy tooth I emphasize, starts to become loose. At first it becomes slightly loose, then more so, and it can simply be easily removed, or it may just fall out on its own. It will no longer make sense to try to save it. That's why an important consequence is the loss of a completely healthy tooth, because the gum continues to recede more and more, the ligament apparatus disappears, and the tooth will be held, so to speak, by just a small edge of the root, which will provide almost no function. It will be impossible to chew with it, it will just be loose, and it will simply have to be removed. So what should you do if your tooth root has become exposed and your gum has already receded? There is only one treatment here: surgical intervention. That is, surgically, a piece of gum is taken from the patient and grafted, meaning it is taken from one area, most often from the upper palate. A small piece of mucosa is taken and then sewn and grafted into the area of exposure. There is no other way to restore the gum without surgical intervention. But in practice, of course, most patients do nothing about it and wait until they either lose a healthy tooth, remove it themselves, or have it removed at the clinic, and then of course they resort either to implantation or to restoring the tooth with crowns. But unfortunately, in my personal experience, patients do not restore or pay attention to this insidious symptom such as gum recession. Of course, dear viewers, it is up to you to decide what to do about your gum recession or exposed roots. But I recommend that you find the time to see a dentist. Only a dentist can determine how critical your situation is right now and what can and should be done about it. If you need to restore your teeth, message me in the messenger. The link is in the description. Take care of yourself and stay healthy.